Guys, welcome back to my vlog and welcome back to another vlog. So today we have a baby shower at my clinic and currently I'm 32 weeks pregnant, so I'll carry you guys along. Yeah.
Para poder cocinar de manera saludable y también para que después puedan implementar esto en sus vidas.
So, as the kids grow, we have the two.
Just a little bit on car seat safety, and then backwards. Keep it backwards. There we go. Thank you. A little bit on safety, and then a little bit specifically about your infant and how they're riding, and then I have a quick video to show you some tips for installing. Make sure you stop by out there. We have information for you, lots of outreach information, but one of the most important things is the local Houston contacts if you have any questions or concerns.
De accidentes para los niños de 71%, entonces eso sí reduce mucho esos tipos de riesgos de accidentes. Y más de muchas personas no saben cómo usarlos. Okay. Todos los niños que son menos de 13 años deben de sentar atrás, porque enfrentarlos a nosotros y traer a sus niños acá realmente una bendición tenerlas hoy compartiendo con nosotros. Good morning, I'm Dr. Caracostis. I'm the Executive Director here at Hope Clinic, and I am just thrilled to have you here at our clinic, sharing with each other and of course sharing with our providers. We strive to provide the best care we can to you because we care for you very, very much. And we want to see happy, healthy babies like many of you have brought today.
You know that our team of OBGYNs are some of the most professional and amazing providers here. And you know that they will follow you to the hospital. They would be with you when you need them the most. And after that, we have a fantastic team of pediatricians, dentists, and eye care providers that will allow you to have and raise healthy children. Ustedes saben que en la clínica tenemos un equipo.
A bit different than this one because this one's a carrier, but most of the things still apply.
Thank you for joining us today to learn about the importance of properly securing a child in their car seat in your vehicle. We will be working with my child, which is 16 months old. We have selected and will be installing a rear-facing convertible car seat. Today we will be installing this rear-facing car seat using lower anchors,
So we're facing in the vehicle.
and a properly applied handle. Our next step is to install
The
this
pull
car seat in
noodles
your
are
vehicle
only
seat.
if you
We will
can't
be
get the
doing this
seat.
by
Sorry, the
fitting
pull noodles are
the
only if you
lower
can't
anchor
get the seat tight
downward
enough. This is an
to the
option.
vehicle head.
Los noodles solamente son si no puede poner el asiento en el carro muy apretado.
Now we want to
Entonces, a
secure
veces
the
no lo vamos a
seats.
usar.
We are going to do so by putting pressure on the center of the seat
So here.
and tightening the strap, making sure to
then you'll be
remove all of
tightening.
the excess.
Tienen que poner mucha presión en medio del asiento para apretarlo muy bien.
We will now check the tightness of our installation. We do so by grabbing the car seat at the belt pad
So it's
or the lower anchor
attached
straps
right
on
here.
ground.
You want to put your hands near
The
there
car
and
seat
give it a
should not be
wiggle
more than an inch from side to side or front to back.
so that
Para
moves.
revisar,
We are ready to
para
put our
revisar
child.
que está apretado bien, vas a poner tus manos
The
al lado
American
del asiento y
Pediatrics
muévelo
recommends all
al lado
infants and
o
toddlers should
frente
ride in a rear-facing car seat for as long as possible, or until they reach the maximum height and weight allowed by their specific car seat manufacturer. Now we are ready to harness our child in the car seat.
This is the chest
When the
clip.
child is rear-facing,
Chest
we
clip
need to
here.
ensure that the harness strap is at or
broche de
below
techo en medio.
the child's shoulder.
Right here. This is the strap. Make sure it's at or below their shoulder.
Is aligned
Queremos
with
que
the
el arnés
child's
está igual con los hombros o un poco abajo de los hombros.
And the chest clip is at armpit level.
Not
Y el
just around
broche
the
de pecho
child.
en
We do
el,
so by
en
pinching the
en medio
harness
de las
at back and
axilas.
shoulder. If we can pinch that, it's too loose. We need to tighten by pulling on the harness adjuster strap and redo the pinch test.
Okay, so for tightening, make sure that there's not any slack down here around the crotch and that you pull it all the way up. If you
Now
can
we're all
pinch
ready to
it
go.
an
And our
inch,
child is
it's
properly
too
secured.
loose, so you'll need to go tighter.
Para revisar que el arnés está bien puesto, tienes que levantar el bebé y se
Many of you, by show of hands, very first time to be a mom. Very first time. Okay, so that means everybody else is a veteran, right? Congratulations, because
Thank you.
not only were you beautiful before having a baby, but now you're even more beautiful. And I just want to make sure that I tell you that straight up, because we women, we have to stay together and be a unit and a family to help each other out. Again, my name is Kathy. I'm from Urban Harvest. We are a nonprofit organization. We are a partner with Hope Clinic. We have a mobile refrigerated van that shows up right out in the parking lot the second Thursday of every month. Now, why do I want to tell you that? Well, you're pregnant or you have children or both, and in order to provide healthy food, which is what our mission is, we support local farmers and also the food access. Food access meaning that if you shop at any Urban Harvest market, everything is wholesale, meaning that we get everything from local farmers right here in Houston. They have to be in Houston. Some of it is organic, and we have a personal relationship with about 150 farmers. We buy their product, they sell it to us, and what price they sell it to us is what we sell it to you. So for example, We have eggs, we have bread, we have cheese, we have whatever is in season that is growing is what we have as far as our produce. We also have local honey, different types of cheeses. It's like a little grocery store on a refrigerated van. But everything is wholesale. Right now, for example, our eggs are $3 a dozen. We're nonprofit, so our goal is to get out into communities like this one and provide farm, fresh, healthy food for you. The other part of the food access is that if you have an EBD card or a Lone Star card, if you shop at any Urban Harvest Market, we match dollar for dollar up to $40 to give you free produce. So if you bought some eggs and some bread and some meat and let's say some honey, and let's just say that that's $20, and you have an EBD card, you swipe your card, and then we say, oh, hey, Kathy, guess what? You get $20 worth of free produce or fruits, whichever. That's the incentive, up to $40, dollar for dollar.
So after you deliver, one thing you can do is skin-to-skin contact. So we have Meredith here. She's going to talk a little bit more about breastfeeding, and she'll talk a little bit on what skin-to-skin contact is and what that, how that is beneficial for baby. But as soon as you deliver, it's very important if you do plan to breastfeed right away, because that first milk is.
So, but I want you guys to be safe, and that's what I'm here about. We do provide a lot of services here, like STD checks and vaccines, which I hope that you guys do get tested before getting pregnant, while you're pregnant, and then after. You guys are gonna have a lot of fun. I don't care what you guys do outside of here, just play it safe. Next slide. So for hepatitis B, it's a viral infection. It affects your liver. The first part? Ok. Hoy vamos a hablar de varias enfermedades sexuales. Ustedes están aquí porque se han divertido. Y quiero que se...
Appreciate you coming out here and spending time with us. I'm the Community Behavioral Health Program Manager here at Hope Clinic, and my name is Dr. Anila Khan. Just a few things. With all the physical changes that's happening with you right now, please be mindful of your mental health also, because mental health is very crucial. If you do not feel well and you feel overwhelmed, just make a point to let people in the family, your partner know that you need that space. Also, if you're coming for your visits and they're having those forms filled out for you for mental health, please give a very honest answer. How are you feeling? If you're not feeling correctly, if you're feeling depressed, if you're feeling anxious, if you have a lot of things going on, please do mention, because help is available out there. If after pregnancy you are feeling lonely or you cry a lot, you feel depressed, do mention to it that these are some of the things or changes in your mood that's happening right now. And lastly, I just want to make sure that I convey you the message that for Medicaid, the help is available up to 1 year now. You can seek mental health services for a period of 1 year. So do not forget to use that benefits if you're using Medicaid for the delivery. Anyone has any questions regarding any mental?
So good morning, everyone. My name is Meredith. I am a certified nurse midwife and also an international board certified lactation consultant. So I have just a short presentation on breastfeeding basics. I do get a lot of questions about breastfeeding, so hopefully this will answer most of y'all's questions.
Entonces, esta es Meredith. Ella es certificado internacional de lactancia. Entonces ahorita va a dar una corta presentación sobre la
All right, so let's get started. Okay, so here are the recommendations. So the World Health Organization, these are their current guidelines and recommendations. Number one, it's gonna be to initiate breastfeeding within the first hour of life. So what this means is after your baby is born, you wanna try to latch your baby immediately if you can. It's called the golden hour. So during the golden hour, in that first hour after your baby is born, your prolactin levels in your body, they're very high. So that's a great time to try to breastfeed.
Okay. Con acordancia con el World Health Organization, aquí son algunas recomendaciones con lactancia. Ellos recomiendan que comience en esa primera hora que nazca su bebé. Esta primera hora se llama la hora de oro, porque es muy importante, así puede comenzar en ese momento estás produciendo mucho de una hormona que se llama prolactin. Eso le da ayuda a producir leche para su bebé.
All right, so the goal from the World Health Organization is to exclusively breastfeed your baby for the first 6 months of their life. So this means no formula, just straight breast milk, whether you put your baby directly onto your breast or you pump the milk out, whichever. That is the recommendation from them. Another one is to not introduce any complementary foods like the solids, baby food, things like that until your baby is at least 6 months old. So you can introduce that starting at 6 months, but the recommendation is to continue to breastfeed up to age 2 or beyond, should you choose, and the complementary foods are just in addition to the breast milk. So breast milk is still the first thing, and then the other food is complementary.
Okay, otra recomendaciones son
benefits for mom as well. Reduces risk of breast and ovarian cancer, reduces your lifetime risk of getting diabetes type 2, reduced risk of high cholesterol, high blood pressure, heart disease. All of these things could be, you can reduce your risk with just breastfeeding. So most people don't know this. Helps your uterus return to normal size. So it takes the uterus on average roughly, everyone's different, but roughly 6 weeks or so to go back down to normal size. By breastfeeding, it does help it go back down quicker. And then also helps you return to your pre-pregnancy figure a bit sooner because you're burning additional calories each day. So those are the benefits for mom.
Hay muchos beneficios del amamantar para...
This is the number one I feel like most people talk about. The way it strengthens the immune system is when it strengthens their immune system, this allows your baby to be able to receive vaccines and immunizations better. They're able to process that better. So it's very beneficial for them. Also, strengthening their immune system, what this one does here is it helps with all of these here. Reduces the risk of eczema, pneumonia, flu, skin and food allergies, ear infections. Those of you that already have small children, you may know that they get ear infections a lot. It's very common in children. So breastfeeding helps reduce the risk of all of these things here and also decreases the risk of childhood cancer as well after you give birth. So it's like a golden yellow color. This is what it looks like. The volume of it is low. This is normal. After that, your body will transition to full breast milk. The volume will be higher. You'll see the color change. And so this is all you're gonna put out like the first 4 or 5 days or so, up to 5 days, maybe 6 max, after you have a baby. So this is high in protein, low in fat, whereas this one is high in fat and protein. So you can see the difference. So this is what our bodies make. And so this is what you should expect to see. I want to touch on these pictures here. This is a good latch, and then this here is a bad latch. And so another way to look at it would be this is a deep latch, this is shallow. So if you look at this baby, you can see this baby has, their chin is on the breast, the lips are flanged, open, the nose is pretty close. It's not touching the breast, but it's very close. And you can see most of the areola is in baby's mouth. So this is a good deep latch. If you don't have this, if you have this instead, you may experience pain with breastfeeding because only the tip of the nipple is in baby's mouth. This is going to cause you to have pain, chapped nipples, bleeding, all of that stuff that we don't want. And so the recommendation is to get a good deep latch. So I have some steps here. I do recommend you take a picture of this. You want to feed on both breasts, so start on one, empty that side. Feed baby on just one side only. That can cause some issues. Feed your baby on demand, but no longer than every 3 to 4 minutes apart. And then just watch your baby for the feeding cues and make sure you're in a comfortable position.
My goodies bag. Goodie bag. Hi guys. So this is what they gave me for free. Baby food. Yeah, baby, see your food. So hand for me. Baby food. Wipes. Diaper. This is size 4. And some and for me, what's this? With this. Okay, this is stickers. They are stickers, parents. They are stickers for 4th of July, Goodie, all this ceremonial something. For stickers. And I have this bag. They gave me this bag too. So they gave me this bag. They gave me prenatal supplements. Then clothes. This is for 6 months, and this is for newborn. Give the baby book. Some flyers, so like that, and this one too. I don't know what's inside this one. So inside this, we have wipes, diaper rash paste, shampoo for baby, Aveno, eczema cream. Okay, this is drip water. We have hydration multiplier. This also 2-in-1 body whip lotion. I've Dr. Brand bottle. This is Palmer for stretch mark for the belly, and flyers, and this. Let me check what this is. This, I don't know what this for. Oh, for pictures. It says kids for pictures, 1 month, 2 months, 3 months. You know? And this one is 2. I think it's the same thing. Yeah, the same thing. And again, so I have this bag here. This is toy. This is socks. Is this socks or toy? These babies. Can I beep? Excuse me. What is this? Is it a socks or what? I don't know. So we have this. I have nipple bottle. I have soap. Baby soap. Everything here is for the baby. Baby soap. I have wipes from Recitos de Oro. I think it's Spanish. And I have diaper for newborn. Yeah. Also, I have changing mats for the baby. Actually, I have one. I think it's wipes bag, I guess. And baby. Baby shampoo. And baby is it baby? I don't know. It's written in Spanish, so I don't really know. So, and a bottle too. So that is all the goodies inside the box. So thank you for watching. Don't forget to like, comment, and subscribe, and I'll see you guys in my next video. Thank you. Bye. Baby, it's on the way.